Hi, I'm Darren Stiff of DDS Laboratory in beautiful Tampa, Florida, and I'm very excited to share this case with you today. DDS restored 18,000 implant cases last year, and for this case we worked closely with Dr. George Raffoul of Coast Dental. The patient had extensive restorative work. You can see in the radiograph that the implants previously placed were a good spread, but they were not in the ideal angles. Close communication with our customers is key. From the beginning, we worked with Dr. Raffoul on the plan. When possible, we prefer to do screw-retained restorations. That way we can avoid intraoral cementation, which can lead to implant failure. For this case, the screw-retained approach also allowed us to make the 8-unit bridge affordable without sacrificing aesthetics or quality. The implant in number 8 was angled, so Dr. Raffoul used a 17-degree multi-unit abutment there. The other two implants were a bit deep, so we needed taller titanium bases, which we use quite frequently. Okay, so here's how we approached the case. Ultimately, we wanted to make a final restoration that needed no adjustments. First, we made the verification jig and a temporary PMMA restoration. The doctor adjusted the temp, and the patient wore for a couple of weeks. We then took the verified impression. This is the verified model. We use open implant TI bases. They come in 10 millimeters and can be cut. We cut the TI bases to 6 millimeters. Then we protected the interfaces with wax so we could sandblast the chimney of the TI bases. This step is important. It creates more surface area for retention. Then we steam clean the components. We used our DDS production facility in China to design and fabricate the case. Even though we cut the TI bases, we can still use the open implant scan bodies in their library. They have a file for each possible height. We use 3Shape and select the 6 millimeter tall TI base in the order form. We find that we get better scans and better fit using the scan bodies rather than scanning the metal TI bases. Scan bodies were then placed onto the verified model and we scanned them. This provides us with the placement of the implants. We received the temporary PMMA restoration back from the patient. We took the scan of the PMMA restoration to design the final restoration. We know that this fits and the bite is correct. At that point, we needed to make aesthetic adjustments only. This transparent design shows the placement of the titanium bases. Then we show it designed to full contour. Then we design it with a layered cutback. We then verify the design for the final restoration is aligned with a verified model. This is an overlay of the scan of the PMMA over the final design. We check the alignment and therefore eliminate the need for any adjustments on the final restoration. This is the Bisque of the final restoration before it is glazed. The DDS lab in China sends pictures for approval before glazing. Dr. Raffoul and I reviewed them and had them make some minor aesthetic adjustments to the embrasure spaces between 9 and 10 and adjusted the length of 8. This is a highly collaborative process between the doctor and the lab to get the aesthetics right for the patient. Once the adjustments were approved, we glazed the final restoration. We then submitted the restoration to the open implants, titanium bases, and multi-unit cap. After mixing it, we apply it to the TI base and the restoration, insert the bases, clean the excess cement off, and then light cure it. We were all excited to provide that final restoration for the patient. I was chairside that day for our lab, DDS, joined by Prudence from Open Implants. The final restoration required no adjustments, and the doctor and patient were pleased with the final results. The patient was happy and all smiles, but after seeing his new restoration, he exuded a new confidence and a new smile that was ear to ear, and I was happy to give that to him. Thank you for watching, and have a wonderful day.